ivermectin really is kind of a miraculous drug. It really did work for COVID-19. It works for influenza. So if we ever get hit with influenza H5N1, the next pandemic, it's going to work for that. Have some in the cupboard. But it's just incredible the conditions that ivermectin works for. And I've discovered a lot of this by accident. Some of it is preclinical literature. Some of it is just people sending me testimonials, things that they tried. I had patients taking ivermectin for cancer and their psoriasis cleared up, right? Their Lyme disease was cured. And the conditions, they had chronic Lyme they were suffering from Lyme arthritis for decades. And a few weeks of ivermectin, and that cleared up, right? And so there's this whole body of research with repurposed drugs out there, and people are getting all kinds of incredible relief, including in cancer, including stage 4 cancer. And that's just what I'm going to talk to you briefly about tonight. So ivermectin, if we look at what is a repurposed drug, a repurposed drug is a drug that was designed for one purpose and has been discovered for work against something completely different. And now you take that drug and you just use it for something else. And so it's sort of off-label use. And if we look at just, let's say, topical ivermectin, the horse paste. Let's start just with horse paste. The ivermectin paste, ivermectin cream, is actually FDA approved for the treatment of rosacea. A lot of people don't know that, but ivermectin cream is actually FDA approved. Your dermatologist can prescribe it. Now, of course, the doctors hesitate to prescribe it, but it's a 1% ivermectin cream. You could treat rosacea. The ivermectin horse paste is actually 1.87%, so it's stronger. It's almost twice as strong. You can literally use it for any inflammatory or autoimmune skin condition. It'll treat cystic acne, which is the worst possible acne you can have, and it'll clear it completely. It'll clear eczema. Like I said, in many cases, it will clear psoriasis. But most impressive of all, it will clear skin cancers. And I now have tons of testimonials from patients who had either basal cell carcinoma, squamous cell carcinoma, melanoma. They started applying the horse paste twice a day. Within a couple of weeks, you see the skin lesions start changing. You can see it. Just after a couple of weeks of application, the lesion starts changing, it starts getting smaller, and after a month or two, it may fall off completely and it's gone. You can treat any skin cancer with ivermectin paste, the horse paste, the $8, $9 horse paste that, you get at whatever, veterinary supply. And I've had I had one patient, for example, who was putting ivermectin on a tongue cancer, and she could actually feel the lesion start. And it was her doctor who actually wrote to me and said, this patient, she feels her lesion shrinking because she could feel it in her mouth because the lesion was on the tongue. She could feel it every day. After a few weeks, the lesion she could feel it shrinking. You could apply it to breast lumps. And women have reported to me breast lumps shrinking. Even benign lesions like lipomas or all kinds of cysts. Just apply the ivermectin paste and you can see these things shrinking as the ivermectin gets absorbed through the skin. So, the topical ivermectin is a wonderful thing. Get some horse paste, stock up on it, get like 10 tubes. You can literally get the 1% ivermectin cream from India Mart for $2. $2 US. I ordered 30 of them at a time just to make the shipping worth it from India. But it's an incredible thing. And you can, if you get a bunch of tubes, you could give it to your neighbors, you could give it to your loved ones. It's simple. It's simple, and the family doctors are afraid of it. They assume fetal position when you talk to them about this. Seriously. And so, now switching to oral ivermectin, certain autoimmune conditions respond to ivermectin. And the ones that I've seen, rheumatoid arthritis will respond to ivermectin. Juvenile rheumatoid arthritis. I've got juvenile rheumatoid arthritis patients. I have a ballerina, a 16-year-old ballerina who had spondylitis that responded to ivermectin. And she had really trouble with movement and this constant inflammation and so on. So when you've got inflammatory conditions, think ivermectin, low dose, 12 milligrams, 24 milligrams, and it may respond.